Hey, Dr. Scott.
How are you?
I'm good. How are you?
I'm well.
Good to see you.
You as well.
All right. And thank you for, joining for this podcast series. Our goal is to, provide or share lessons that you have learned in your chiropractic journey with a lot of newer, younger chiropractors. Some of them are still in school, some are just graduating. Some of them, a lot of them learn about the clinical side of chiropractic in school, but are not so familiar with what kind of challenges they'll see when they actually start a clinic, run a clinic, and so talking to experienced chiropractors like yourself, would provide them a lot of value.
Yeah, I can mirror that. In chiropractic school, they're great about teaching you the clinical aspect of the career, and they do quite a great job of that. But what they don't do is they don't teach you about anything business. They don't teach you about owning a practice, running a practice. I think we took one course in school called office procedures,
Sure.
and that was it. So it's a big learning curve when you get out of school. And depending on if you go and start your own practice or if you work for somebody, you you learn how other people do it, right? Or you create
Right.
your own avenues. And personally, I worked for a couple of chiropractors out of college, and it was great for me to get the clinical training under them and to get better at my craft. But I didn't resonate with how they ran the business. So by the time I opened my business, I didn't know how to run a practice. I just knew what I didn't want to do in my practice.
Interesting. Very
Yeah.
interesting. Wow. So maybe you can start by talking about your journey. What inspired you to pursue chiropractic?
Yeah, when I was young, I was in a rollover car accident. When I was 17, I fell asleep. I was coming back from a camping trip, and I closed my eyes and fell asleep, and nothing involved other than being tired, and I crashed my car. And so I wound up in the hospital, and I broke my wrist, and I had a concussion, but I severely subluxated my lumbo-pelvic joint, and I couldn't. I healed to the point where I could stand up straight and walk after several weeks, but then school started, and I couldn't wear my backpack. I couldn't train. I couldn't practice for the basketball team, and that was the first love of my life was baseball and basketball. And so when I couldn't practice, I got really nervous and I got scared. And that's what led me to chiropractic. And through conservative treatment plan of chiropractic that started off understanding what the problem was with a set of x-rays and a detailed exam, and we worked to make sure that I was a right fit for the practice, right? And then we worked diligently until the end of the care plan, which was about a 6 to 8 week care plan, where I was in a traumatic rollover car accident. So there was certainly some treatment that needed to be done. But it was just a really good introduction to chiropractic in that there's something else other than the Western medical system out there to help folks. Um, and that's what got me back to playing sports. So when I was a 17-year-old kid, I really got the world of that there's a whole host of healthcare options out there, not just what's put in front of us with the Western medical system. And by the time I got out of college, I knew that I wanted to do something in the healthcare industry. So I pursued visiting chiropractors' offices. I pursued visiting physical therapy offices, medical doctors' offices. And what I found in shadowing was that I saw people getting better in a chiropractic setting quicker than in other offices. And sometimes that's because, if you go into a physical therapist, you might be going for you're healing from a car accident, or you've had surgery, or there's some major trauma that's happened that sends you to the PT or the medical doctor. A lot of folks go to the medical doctor not when they're well, but when they're sick, and so it's a longer healing time and care plan. And what I found with shadowing the chiropractor who helped me was that we just saw people getting better quicker, and that really gave me a lot of confidence to go into the industry. And um, I come to work every day super excited to be at work. I follow my energy, and my energy is all about helping people get better and um, being a somebody in the community that people can trust. and trying to run my business with as much integrity as possible. And that, takes me from an 8:30 a.m. start into a 5 p.m. finish, and the day just feels like it flies by. And I'm able to pick my staff, right? I'm able to pick the people that I work with. I have a phenomenal office manager, an admin, and we're growing the practice with other healthcare practitioners. We're looking to hire a chiropractor to work under me. So we're really building out the practice quite nicely, but it's taken some time to get here.
Got it, got it. And what year did you go to chiropractic school? What
I
did you
graduated in 2008.
2008? And was it Life Vest?
It was Life West in Hayward, yes, in
Got it,
California.
got it.
Yeah.
Um, and so you go to chiropractic school, you graduate, and as you're graduating, like what kind of options were you considering as you're finishing school?
As I was finishing school, I really wanted to hone my adjusting skills, right? They teach you all the clinical stuff, and they, the um, hands-on portion of clinic, right?
Mhm.
Is it's very rigorous, and you have to meet all the standards, but you're still practicing under other chiropractors, and you're doing, I was doing a lot of adjusting seminars and really just trying to get my skills, my adjusting skills to a point where when I went out into the community as a licensed professional, I was able to be, effective. And personally, I felt like I was good, but not where I wanted to be. So my primary goal in going to find a job was to find a clinic that I could, learn a decent amount of adjusting skills. And when my first office was a high volume clinic, and that was fine. It wasn't necessarily the business model that I chose when I opened my clinic, but it was great to get me springboarded onto having better adjusting skills. And shortly after that, I did open my own practice, and it's been a great path ever since, and um, I couldn't imagine doing anything else.
Got it, got it. So you finished, you graduated from Life Vest in 2008. You started this clinic in what, 2013?
I did. So I started in 2008, went to work for another chiropractor, then joined one more chiropractic office
Okay.
before I actually injured myself again and had to take a little bit of time off of work. So I love to surf, and I was surfing one day, and I got rolled by a wave and I broke my wrist. So I had to take a considerable amount of time off because not only did I break my wrist, but I tore a ligament that needed to be repaired. So the actual healing time from the injury was far worse than the actual injury itself. Uh,
Wow.
and so in that time we moved. So I wasn't living in the same place that I was practicing. We moved to a new area, and I spent that time really developing what I would be doing in a practice, meeting the community. One of the most important things that I think any business professional entrepreneur, regardless if it's chiropractic or not, is networking. And so I really spent that year networking and meeting the community and meeting referral partners that I would be able to use when I started my practice. And so I was out of the business for about a year, and then a big push to open my practice in 2013. And it was probably the best thing I've ever done because it gave me the freedom to practice the way that I wanted to and really develop something that I felt good about and comfortable about. And I know I practice based off of my life experiences, right? So when I was younger and I was in the rollover car accident, that's how I found chiropractic. And after the surfing accident is how I found active release therapy, the soft
Mm,
tissue treatment method. And now I look my patients in the eyes with 100% confidence, letting them know that what we do in here works for a lot of people. And if you've ever listened to Steph Curry talk, or if you've listened to Tom Brady talk, or high level athletes like that, they've all received active release therapy and chiropractic, and they hold it in very high regard. And so my joke to my patients is, hey, if it's good enough for Steph Curry and Tom Brady, it's good enough for us, right? And so yeah, it's been a really fantastic journey for myself and my staff. My staff is all of my staff is I've cultivated from patients to working for me.
sure.
Um, and it's a great team. We have a lot of fun. We work really hard, and it's a really good vibe in the office because everybody comes to work really excited to be here.
Right, right. Very nice. And take me back to like 2013, you're about to start your clinic. How did you figure out where your location, like where do you want to start and what was that thought process like?
Yeah, it really wasn't anything concrete for chiropractic. It was where do we want to be, right?
Okay,
Where do we want to settle down? And for me, commuting is a really big thing, and I did not want to commute, right?
sure.
Um, so we found a beautiful little town in Silicon Valley. We really loved the aspect that it was great weather. It's close to a lot of attractions that we pursue, right? So it's right by the beach. It's not too far from the mountains. It's between two big cities. It's not too far from the East Bay. So it really is a very central location. It's close to family, which was a very big thing for us because we have two boys and we want them to be near their family, their aunts and uncles, their grandparents. Um, and it really spoke to me being in the middle of Silicon Valley. There's so much commerce here. There's so much
Sure.
business, big business, right?
Right,
And there's a lot of chiropractors, don't get me wrong, but in the world of abundance, there's plenty for everybody, right?
right, right.
So I transitioned to a chiropractic and active release therapy office, and people are hard workers here. They work hard, they play hard. I have a lot of cyclists, athletes, runners, a lot of weekend warriors. I treat high school athletes, college athletes, but I really do have a family practice. So it was a great location to be able to serve the entire population that we love to serve.
Got it, got
Um,
it. Oh,
so it certainly wasn't like, here's a hotbed for chiropractic. We're going to get into that area because we want to be successful. It was, I live 10 blocks from where I work. My kids go to great schools. We have family near, all the things that I mentioned before were big drivers to settling down in the location that we picked.
got it, got it. And then you mentioned that before you even opened the clinic, you spent time actually kind of networking, right? Could
Yeah.
you walk me through a little bit about like how did that how does that
Oh, yeah.
process work?
So a little unconventional. I started my business in 2013. So as of 2011, 2012, we moved to the area and I was not able to practice. So I really spent that time joining business networking groups where there were doctors, lawyers, financial advisors, um, other healthcare professionals, just people who are entrepreneurs and people who are business professionals who we're busy all day, and so we can congregate. We can make sure that we understand who we are, what we do, and how we do it, and gain the know, like, and trust. Right? You get to know somebody, you
Hmm.
spend enough time with them, you find out if you like somebody or not, and
Right.
then you gain some trust with the commonalities that you have. And so I have a bulletin board in my office where I have 50 business cards, and those are all of my friends, right? Not my colleagues. They're all my friends who I've met throughout the past 13 years in San Carlos, who are still in business, who practice with integrity, um, and they practice in doing whatever they do, like we do at our practice, right?
Yep.
And so when somebody, we have not a considerable amount of time, but we see people for about 15, 20 minutes in our office for an appointment. And so I have 20 minutes to talk with people about what's going on with them. And then, just some ancillary other stuff. And it's just if somebody says, oh, I need to pave my driveway, right? Well,
Mm.
one of my friends has a paving business and they're phenomenal. Let me connect you with so and so, right? And so it's
Got it.
just a way of doing business. So you have a whole host of other people who are thinking about you and you're thinking about them
Sure.
when you're doing your thing. And like I said, I have a decent amount of time to talk with people. And so I'm never pushing, but I'm always listening for things that people need. And I love to connect people and everybody else in that networking space. That's something that's important to them because they're a connector as well. And so you group yourself around a bunch of like-minded people, and then now you have a whole team of people who want to network with you for you because of the know, like, and trust. Um,
Got it.
so I did things like that. And then probably the most unconventional thing for the day and age we live in is I got in my suit and I got a bunch of business cards and I walked up and down the main street in San Carlos and handed out business cards, shook hands, let people know what I was doing. And it was wildly unsuccessful doing that. I don't think I got one patient from it, but in the greater scheme of things of being an entrepreneur, your successes are your successes and your failures are your failures. And if I didn't make it doing what I did, I didn't want to think back on, however many years before and thought to myself, well, if I just would have done that one thing, maybe things would have been different.
Sure.
So, I go big or go home. And so it was something that I did. And I look back now and I think to myself, well, it took some initiative to go out and do it. It wasn't successful. Probably won't do it again, but it was something that I felt like I needed to do at the time. So from doing that to joining the networking groups, I coached basketball. Right
Okay.
before my kids were even born, I was coaching basketball at the middle school level because I love basketball and because I want to meet people. I want to meet the administration. I want to meet the parents of the kids who I'm coaching. I just want to make sure that people know who we are and what we do. So if they need a chiropractor and we're a good fit for them, we can fit the bill.
Got it. Very nice. And you still coach?
I do not. Now I have twin boys who are 9 years old and they take a lot of my time, but I do coach their baseball.
Got it. Okay, there you go. All right. And so you opened your clinic, and like how much time did it take from the point you opened a new clinic to the point wherein you were at capacity or really busy, wherein you're like, okay, now we are doing okay.
Yeah, quite a while. Yeah, it took quite a while. I had a bit of a help because, like I said, we're in the middle of Silicon Valley, and doing the networking, I met a lady who worked at a corporation around here, and she invited me in for a meet and greet to the corporation, and we started doing corporate wellness with that company, with that corporation, from 2013 until COVID.
Oh
So
wow.
yeah, so that was a real good springboard for my business in having a kind of an aid, right? To where
Sure.
I was building my practice. I kind of had two practices at the time, right? I was building my practice, my private practice, and then for a couple days a week for a shift, I would go over to the corporation and treat their folks. So it was a little bit easier for me to build the practice around those two offices rather than just build the one community practice, which I think would have taken me a little bit longer. Just uh,
Um,
in the numbers game.
Yeah. And another question that comes up, from chiropractors sometimes who are, wondering what way to start is, open a new clinic, from scratch or buy an existing practice. What are your thoughts about that?
I did look at buying existing practices, um, and I think that is a concrete way to go if you are a good fit for the practice. I think that what I've seen from some colleagues is that they buy a practice that looks lucrative, but it's not really the best fit for them. They think that they can change the way the practice runs, which they certainly can,
Sure.
but it's a shock to the system of the clinic when you come in and you say, "Hey, we're going to be doing things way different," right?
Right, right.
And so I looked at some practices to buy, although they were somewhat affordable, it just wasn't the right fit for me. And so I thought to myself, I don't mind hard work. I can do hard things. And I was up for the challenge of starting a business. And when I came to the city that I practice in, I knew not one person.
Oh,
It
wow.
was a really big push to become known in the community, and that's why I was such an avid networker. And I have to I have to credit my wife. She, even when I was not feeling it, she would, you know, urge me to go to network. And there. What I'll say is, you never know when you're going to meet your next best referral source. You never
Sure.
know. And I remember it was early summer and there was something else that I was doing that I was really into. And my wife said, "Hey, remember there's that networking event going on? I'd love to go with you to the networking event." And I was like, "Well, I'm not sure about this one, maybe next one." And there's something about it where she just was she's the oracle, right? She was just like, I really think we should go to this. That'll always be there. Come on, let's go. And I was like, you know what, you're right, let's go. And that's where I met my, at the time, my best referral source that through, gosh, how many iterations of referrals have come from that one person. I could probably trace back 25, 30 clients or patients to that one person. A lot of family, a lot of friends. They were in the insurance business, right?
Hmm.
So they introduced me to their whole team, and the whole team comes in, and we happen to be a really good fit for him and his colleagues and his family and his friends, and we still see them, and it's such a trip down memory lane, even though it wasn't that long ago, thinking like I remember the day that I met him at that
Hmm.
networking event and that I didn't want to go to, or
Right.
I wasn't feeling it that day, right?
Got it. Got it.
And I'm so glad that I went because you never know when you're going to meet your next best referral source.
Wow. Wow. That's a very nice story. That's a very nice
Yeah.
story.
So, to answer your question, I think that if the idea of buying a clinic is something that you really like and the doctor is able to stay on and really usher you into the clinic and have like an exit strategy and not just leave day one that you start practicing, I think that could be a very good thing for the right person. But I do think that with the proper networking and the initiative that anybody can start a practice themselves, and it's a lot of hard work, but anybody can do it. And um, it really is quite gratifying looking back and seeing what we built.
Got it. Got it. Very nice. I'll change gears and talk a little bit about your techniques. You mentioned earlier about active release techniques that you
Yeah,
practice.
yeah.
So could you could you walk us through the how that works and how does it benefit your patients?
Yeah, absolutely. We're chiropractors, so we adjust, right? This is what we do. We also have the adjunct therapy of the soft tissue mobilization technique, which is active release therapy. I practice with diversified method, rather specific adjustments, but we really focus on the soft tissue because we want to make sure we're taking care of the entire musculoskeletal system, the neuromusculoskeletal system,
Mm.
right? And in my opinion, and what's worked for me, how I can look people straight in the eyes and say, listen, there's a lot of value in these soft tissue methods. There's a lot of value in chiropractic, and I believe that when we pair them together, that's when you get better the quickest, right?
Mm.
And so a lot of times we'll kind of have somebody come in and we'll do a lot of soft tissue work. We'll do a little bit of adjusting and we'll do some more soft tissue work, or we'll adjust first and then we'll do the soft tissue work. And it's very specific patient to patient. There are some people who come in who are going through training for a marathon or something like that, right? And it's a lot of soft tissue work and not that much adjusting. Or sometimes they come in and they're feeling rather well, and we just maybe adjust the pelvis. And we'll do a little bit of work around the pelvis when we adjust with the active release therapy. Um, but we just find it as a really appropriate adjunct therapy to the chiropractic.
Got it. Got it.
And I've been
Um,
doing that since before I opened my practice in 2013.
got it. And in addition to active release therapy, you also have acupuncturists and massage therapists on your staff as
Yeah,
well?
yeah, we do. Right now, we're building the office out with other healthcare professionals. And we have acupuncture, massage, and nutrition, right? And it's a really good model for us because we want to take care of the entire person, right? And I'm not the expert in nutrition and I'm not the expert in acupuncture. So in order to be able to refer those for our patients to a safe place for acupuncture, massage, nutritional support, we want to make sure that we are doing that with the best people that we know. So we keep them in-house, and everybody has a space here, and we like the concept of inter-referrals. Um, when people are on my table for a chiropractic care plan, that's what we're doing. Um, a lot of times, if we'll have somebody who goes through the chiropractic care plan that maybe came from a personal injury case, right? We do a little bit of that. And we see that acupuncture would be the next right step for them. We can certainly keep that in-house and make sure that they go to their appointments as needed, so it'll benefit them to that maximum benefit. Um, we do some corrective exercise in the office, and I think that's a really good follow-up step for the active release therapy and the chiropractic. So we're really trying to get that whole person's neuromusculoskeletal system into a position where the body can heal itself and our patients can regain everything that they used to do, from walking to hiking to cycling to competitive sports.
Got it. Very nice. Very nice. Um, you know, how do you think the chiropractic profession is changing? And what do you see happening in maybe in the next 5 to 10 years overall
Oh
in the
gosh, I wish I had the crystal ball. Um, I see, I'll answer it like this. Um, I see chiropractic as being a mainstay in healthcare in the present and in the future. I think what I've noticed from my experience with the Western medical model is that it's harder to see medical doctors, at least where I live.
Sure.
Harder to see medical doctors, schedule appointments with specialists. When we refer folks out to physical therapy, oftentimes they can't see the physical therapist for a month, or they, might have one intro session and then they can't see the PT for a few weeks. And so I see us being more accessible and people leaning on chiropractic more because, number one, for injuries that we can help with, I think we're a more appropriate fit for the patient than going to see a medical doctor for a sprain or a strain, or if you have a fall and maybe you hurt your rib, you can get an x-ray, but if there's no fracture, there's really not much to do. So we can certainly help people on demand, with more, especially in our office with the soft tissue work that we do, with more efficacy than I think somebody who doesn't practice the way that we do, or somebody who's in a Western medical model where they can let them know how to medicate with NSAIDs or maybe give them a muscle relaxer, but they're not really touching the problem. So I see chiropractic in our area, like, which I can only speak to, as growing in the near future with the opportunity to be seen regularly, more on demand, with more appropriate skills and better outcomes.
Got it. Got it. Very nice. Um, and what do you see are some of the challenges that chiropractors face today?
I don't think it's a new thing. And so I don't think that it's the challenges that chiropractors are facing today, but I do see chiropractic as being, it could be a more unified profession,
Hmm.
right? I think that all chiropractors believe in the same thing, right? Like they
Right.
believe in the power of the body to heal itself. I think where it's more of a ununified profession is that there's a lot of different techniques, and a lot of chiropractors are very comfortable with their technique, and we might say, well, this technique works the best. Where
Sure.
I I just know what I do and I know what I'm comfortable with, but I certainly think if you see an upper cervical doctor or a Gonstead doctor, you are going to get better in that setting, right? There might be a setting that's a better fit for you, but I
Sure.
think that the power of the body to heal itself is a universal thing. So maybe in the I practice like this and it's the best, where in someone else says I practice like this and it's the best. That's where I see the conflict, and that's where I see the field as it could be a more unified field.
Got it. Got it. That makes a lot of sense. Um, and you know, maybe some patients might be watching this video as well, and so what would be your message to somebody, like why should they come see a chiropractor, right? Maybe they're experiencing some kind of issue, or maybe they're an athlete and they are training for something. When should somebody go see you?
Yeah. Great question, Suki. I think that chiropractic is great for people who are not in pain. It's great for wellness, right? So I adjust my entire family, right? When they're feeling great, when they're not feeling great. My kids come in every Friday with my wife. They're my last patients for the week, and we treat everybody. And that's just what we do as a family, right? So I think people can come into chiropractic settings when they're feeling great just to maintain feeling great. When people aren't feeling great, um, I believe that coming to a chiropractic setting will allow the body to heal itself, right? Well, what we do in the office, at least in my office, and with active release therapy and the chiropractic pairing, is we examine everybody. We make sure it's safe to treat them, number one. If it's not safe to treat them, then we're going to refer them out and we'll have them go through the tests to make sure that we understand what's going on and to see if it's safe to treat them in the future, right? So we want to make sure that number one, it's safe to treat everybody. We do a lot of exams. We're very conservative in our care, and that's first and foremost because we don't want to hurt anybody. Number two, like I said, is the experience that we have in neuromusculoskeletal disorders. And we're hands-on and we're actually treating the patient and we're treating the main cause of the issue. We're not treating around it. We're not medicating to mask it. We're treating the main cause of the issue. So if we're spot on in our recommendation for a care plan, we should take the person from not feeling great to feeling a whole lot better. And then we can work in corrective exercise, we can work in soft tissue and anything else that we need that might be positive for the patient. Um, and then just the access to care, right?
Mm.
We work with a waiting list, but we'll get you in a couple days to a week. We're not going to make you wait a month to come in, right? And I'm not throwing any shade on the Western medical community or physical therapy. I refer to Western medical doctors. I refer to orthopedists. I refer to physical therapists quite regularly. With what we do in our office, we can be better. We can be more accessible than a medical center where it's a corporation or a physical therapy office that's inundated with patients because the medical doctor knows that it's safe to send them to or thinks that it's safe to send them to a physical therapist. And not that it's not safe, but I would encourage all of my medical doctor referrals to consider us as well as physical therapy when making an appropriate recommendation for care outside of their office.
Got it, got it. And I noticed even on your website, when somebody's trying to book an appointment, it says that, hey, maybe appointment might not be available the same day, but if you need to see us, just give us a call and you will try to accommodate, right? So
And that's what
that's
we
a
have that waitlist setting. And one of the great things about zHealth is that there's a waitlist setting now. We can create a waitlist on the app where it's part of the home screen where we see all the practitioners and then off to the side by hour by day who we could call for an appointment who's on the waitlist. And we're very excited about that setting because it's just one less thing that the office staff has to do to manage. Um, these a list elsewhere. We can keep it in one place.
got
Yeah.
it. Excellent. All right. Any final words of advice to young chiropractors out there who are in the early stages of their chiropractic journey?
Yeah, I would say that follow your energy, right? Follow your energy. Different from follow your passion. Everyone's got passions, right? I have 30 passions, but
Yeah.
and I love to do all of those passions. I love to, coach baseball with my kids. I love to surf. I love to play golf. I love to, go on hikes with my family. Like these are all passions, but my energy brings me to my office every day and creates a foundation here that everybody who comes in the office, whether you work here or you're a patient here, feels the good vibes, right?
Yeah.
And so I would say to any chiropractor out there, um, follow your energy. It should feel good, right? If it doesn't feel good, you might not be in the right setting, uh,
Hmm.
and it's okay to take the leap of faith and go out on your own because if you are if your intention is right, if you're practicing with integrity, people will feel that in the right community. And I think that anybody could be successful if their intentions are appropriate and they are good at what they do and they are serious about what they do. Um, and then have a really not appropriate, but like pick your staff well. Right. I
Hmm.
think that's a really big thing. You have to be able to trust your staff. And
Right.
so that's a big thing for our practice because while I'm in the adjusting room for most of the day, I have to trust that my staff are out there doing the appropriate things. And we always have like a meeting at the end of the day just to go over the high points. Then we certainly have our weekly meetings to go over what our intention is for the week and the weekly wrap up. But it's being able to trust the staff that they're doing everything out there that they need to do so I can focus on what I need to do in here and take care of my people.
And I personally know your staff, so I can vouch for like how an incredible set of team members you have
Thank
out
you.
there, and so makes a lot of sense.
Thank you, Suki. Yeah,
Dr. Scott, this was a pleasure. Thank you so much for coming over. I know you're a busy person, so taking time out of your busy day to share some of your thoughts, insights, your journey,
yeah,
it's been incredible. And hopefully, a lot of viewers would find this valuable. And thank you again for being able to do this.
absolutely. It's always good to talk to you, Suki.
Yeah.